Are my large eyelids, deep crease, and drooping normal? I'm 35 years old and very self-conscious about my eyes. I'm pretty sure this is not a normal eye shape. Is there anything I can do to help open my eye more? I'm constantly asked if I'm tired, even when I'm not. Eye doctors comment on how droopy my one eyelid is. I do believe it's droopy, but what about the large amount of eyelid? Thanks.
Thank you for your question. You're 35 years old and you've submitted a photo and you're asking if the large eyelid and the drooping, is that normal? And so certainly that photo is very, very helpful, and I can share with you my approach to dealing with someone like yourself when you come to a practice like mine. I'm a cosmetic oculofacial plastic surgeon. I specialize in cosmetic surgery of the eyes, face, and body, and am fellowship certified by training through the American Society of Oculofacial Plastic Surgery. I've been in practice for over 20 years, and basically to begin with, we can define your condition, and your condition is referred to as ptosis. Ptosis means drooping, and in your situation, it's eyelid ptosis. Now, the question that comes to mind first is this new onset, or is this a more recent onset, or is this something you've always had and recently has gotten worse? Now, the reason we would want to know this is if your eyes were perfectly wide open and they were fine for your whole life, and then you recently had this new sudden onset, well, that requires neurologic workup to look for possible neurologic causes. If your eyes were always relatively low and you can look back at your old photos and that the eyelids have drooped more recently, well, that could be a congenital ptosis, which has gotten a little bit worse. That means that you were born with the ptosis and it got a little bit worse. Now, there is also acquired ptosis in somebody who can look like this, where the eyelid crease is very high and there's a large lid. But typically, that's referred to as involutional ptosis, and it's usually more age-related. And age-related meaning someone over in their late 50s and older. And very often it's related to just thinning of a tendon called the levator aponeurosis that gets thinner over time and the eyelid droops. But in a 35-year-old, what is more common if it's acquired is sometimes in association with contact lens wear. A lot of times people who wear contact lenses, especially those who wear hard lenses, can have thinning of that aponeurosis or tendon. So with the assumption after you've made this, had the workup for the neurologic workup is clear and it's basically a muscle-related ptosis, we do something called levator advancement surgery. That means taking the muscle that lifts the eyelid, the word levator is like the word elevator, to lift, and we move it forward and correct the position that it should be in. A lot of times it's thin or it's slipped back or a combination of both. Now, during this surgery, we actually have you awake for this very important part because the muscle is very sensitive. And we have you open your eyes and look at you from the front and sit you up, and want to make sure that that the eyelid's height and shape and contour is desirable and is symmetric. It's remarkably complex and is elegant in the same way that it's just a lot of small factors that can have to be balanced in order to get a nice shape. This is mostly the domain of oculofacial, oculoplastic surgeons. But just to make sure that you have to rule out neurologic causes, if just to get that out of the way, I would recommend you meet with a neurologist, an ophthalmologist, or a neuro-ophthalmologist to at least have the neurologic issues worked out. Look back at your photos, bring the photos with you when you meet your doctor so that they can look at what you look like a year ago, 5 years ago, 10 years ago, just to see if how much of a change there is. You need a more detailed examination to really determine what kind of ptosis you have. But certainly this isn't normal. It is, your eyelids are much too low, and you should meet with a doctor to evaluate what your diagnosis is, to determine, I should say, what your diagnosis is, and then move forward with the appropriate medical or surgical treatment as is appropriate for the diagnosis. So I hope that was helpful. I wish you the best of luck, and thank you for your question.